Thank you. Thank you, Tim.
Yeah, excited to have you. And of course, having Antonio here, our fellow partner at Growthink. What I was most excited about for this conversation is the opportunity to really dive into TyMe Cancer Research Institute and kind of the impetus behind that, but really talk as well about the pivot, the professional pivot, because you're very successful in the realm of real estate. You have other properties down in Florida, but kind of like how does the entrepreneur make that leap? So maybe we can start with what's happening with the big vision of the TyMe Cancer Research Institute. How did you get there? And then we'll use that as our launch pad to get into the conversation.
Maybe we start with the reason and cause.
Sure.
What's a real estate developer doing in a healthcare practice? Frankly, last decade, I've been in the real estate part of the healthcare. I develop my specialty is healthcare real estate development. So I meet with folks and understand, what happens inside the real estate, but that's not my core business. So this Tiny Institute was created due to a very unfortunate personal event I lived through with my family. Unfortunately, our 16-year-old son was diagnosed with osteosarcoma, which is a very nasty bone cancer. So we battled that disease for about 3 years, multiple cities, many different hospital systems, multiple surgeries, a very painful and frankly disastrous experience, as you can imagine. So ultimately, unfortunately, we weren't able to save him in spite of all our efforts. And what made it even worse, we had to go through all of this in the middle of COVID. So
Mhm.
I remember having to go to Houston, staying at a hotel. We really couldn't get out. And, when my son had surgery, at times 18, 19-hour surgeries, when he came out, there could only be one parent. It was my wife, and I couldn't even get in and visit with him. Very, very challenging, difficult timeline. So towards the end, when I was told that there was nothing more that could be done, so I had to accept the unfortunate fact. First, it was denial, and then it was anger, then it was sadness. Then ultimately, really frankly, didn't know what I was going to do. I didn't know how to pick myself up, and I'm a very self-driven, motivated individual. I've been an entrepreneur since I was 18 years old, and don't need much to get motivated, but it was difficult to try to get on my feet. Through that experience and right at the end. So mysteriously and call it fate or luck of draw, I met some very valuable individuals who had been dedicating their entire careers and lives into cancer research and drug discovery. So we happened to meet about the timeline where I was lost, looking for direction. So the more I talked to them and I understood some of the challenges and lack of right direction in drug discovery, and the reason why, I wonder quite often, going through the experience and treatments with my son, that they were giving him drugs that were discovered 30 years ago. There was simply no new drugs, and it was beyond belief for me. Where as technology, everything advances. I mean, think about, there was no cell phones 30 years ago.
Right.
Think about the cars from 30 years ago. Why do we have the same drug that impacts, children's lives? And no improvement over 30 years ago. I was not understanding that. And so meeting with the right people and discussing through the challenges in the industry and why they weren't able to bring some of these amazing drugs that were discovered onto the patients and people where they ended up at the shelves. It was really disturbing to me. And so it really created a spark inside of me. I said, instead of going down and giving up on life, maybe I can start utilizing my researches, capabilities, and relationships and many strengths I have to bring together a team of people where I could go and save the next. My son's name is Tyler, and I wasn't able to save it, but the hope of saving the next Tyler, knowing that he will have the parents like us, and he would have a father that's going through what I've gone through. So that was literally the hope that kind of paused me from going down further and losing my soul through the experience to get back on my feet. So the tiny idea and vision was basically created by losing my son and hanging on to a hope of doing something that could help the next child.
Beautiful. That's beautiful.
This is a, very impressive story and very inspiring story, first of all. But wanted to ask you about how do you go about this big vision, and what is the big vision? Maybe let's start with that so that it's clear. Because it is an ambitious plan, the one that your team and our team work together on. Just so that people understand what that experience sparked.
So, spending quite a bit of time over the last 3 years since his passing, and establishing a really solid relationship with these experts in the field, we start looking at ways, how do we change the system? I mean, it's very difficult. You have cancer is the biggest killer around the globe. 20 million people pretty much dies each year. And when I found out that 50% of all cancers are preventable, we focus on prevention. So we're not going to show up day one and basically discover a cure for cancer. So TyMe is a many-facet structure that doesn't exist anywhere in the world. There are bits and pieces that are being done, especially in recent years. You guys heard about some of the screening centers, prevention centers are popping up now around the world. But our TyMe model is a total comprehensive package where we focus on prevention, screening through education, and some of the latest and greatest AI-driven technology. And we also have a drug discovery and development and manufacturing arm. So as a total package, it's a one-stop shop. Just kind of to explain to you visually, you imagine one building, 30,000 square feet. The first floor is the clinic space where we have, again, very state-of-the-art facility with folks that have been studying clinic patient care and prevention and screening throughout their entire careers. So we gather those people in a setting that doesn't exist anywhere else. Because the current model, you guys are aware of that. Our current healthcare system basically waits for someone to get sick, and then you go to the hospital or a doctor, and they'll take care of your issue. So there hasn't been hardly any focus on keeping people healthy so that they don't end up in the hospital. So again, this model is all about keeping healthy people healthy and giving them guidance and giving them tools and education and a platform where they can actually accomplish that. So going back to the two-story, 15,000 square feet, first floor is a clinic, and there's a section that's called Health Hub. So in the clinic, you come in, we interview you, spend a lot of time with you at your first visit. We get into as detailed as where you were born, your genetics, your family history. If you're born in Long Island, the section of Long Island is known for a specific cancer. So we start marking your risk factors with particular cancer. So it's a very thorough process. Well, by the time we finish your evaluation, we know exactly what cancers you are prone to potentially have. And we basically create a database for you. It's very high-tech AI-driven technology that we use. And we also put you through a very rigid screening process where we utilize some of the latest and greatest equipment machines that are developed by some of the top healthcare equipment developers in the world, major names. There are equipment now that actually can scan and detect up to 75 different cancer types. So we utilize and leverage those screening techniques, and we look at the blood work. We do actually imaging screens. So that's the prevention and screening center. On the other side, we have a place which is my favorite spot. It's called Health Hub. This is one spot. You walk in, you have actually a nutritionist that you can walk into and talk, and a healthy person at age 50, if you wonder how your body is doing and if you're doing everything you're supposed to be doing, and you actually have somebody confirm that information. The clinic will look at your blood work and basically give you a printout of exactly where you are with your health, and the nutritionist can guide you through what may be needed, what extra steps you can take. And then right next to the nutritionist, you'll have a fitness coach who will actually take you to our gym and put you on the machines and evaluate your physical fitness, tell you where you are based on your age. And, since COVID, unfortunately, mental health has become one of the major issues, and it impacts everybody's lives. So we have folks there that addresses mental health issues. So it's a total package under one roof where you can go in, get your screening done, and then exactly figure out where your body is, how healthy you are, and what needs to be done, how to get the best performance from your body. So frankly, the creation of the hub was due to the fact that as I was going through, as you can imagine, the tough times and agony and stress of 3 years of, watching literally my son go through a miserable process. At the end, after he passed away, I really didn't know what kind of condition I was in. I wanted to go to a place where I can get evaluated. To this date, guys, I haven't found that place yet. I'm part of a very high level executive health program where I pay several thousands of dollars just to be a member, and they weren't able to connect the dots. And this is one of the best healthcare systems in the world. So I'm like, why can't we have a place where we have all those elements in the same place? People go through stress, when you reach age 45, 50, you have a good career, you have a financial freedom, and you can afford to do certain things to maintain your health and improve your health. And why is not one place that you can go in and get all those in one-stop shop? So anyway, that was kind of the reason cause of creation of Health Hub. That's on the first floor. We go to second floor, it's state-of-the-art laboratories where we actually discover and develop drugs and we manufacture drugs. So we have a potential partner we identified out of India, where there is a substantial amount of advancement out of India, as you guys know. You are somewhat, involved in the healthcare. You guys know a lot of drug manufacturing discovery is being done in India now. A lot of manufacture is coming out of India. So we partner with a group where we can actually have the latest and greatest AI-driven technology, so we can actually develop medication and we can put them through the system, get them approved sooner than what's being done right now. So our target is to create a vaccination and produce it and have it available in 6 weeks. The timeline was 13 years until recently, and it's down to 6 months currently. We're hoping and we're pushing to get that timeline to a simple 6-week timeline. So that's what happens in the drug discovery and development. And our broader vision is to actually manufacture drugs in mass quantities here in Jacksonville, Florida, bring drug manufacture into the United States.
I love it. It's very impressive, and the ability to connect the dots from that prevention and early detection, but at the same time work on advancing actually research and development. I agree with you. It's probably never been done, and certainly not under one roof.
You go through this terrible experience, you're passionate about the solution, you have your own experiences where you realize that the solution doesn't exist, or maybe it exists in parts that aren't put together. Seems like you have an aha moment. But again, you started at the top of this saying, what do I know about the healthcare industry? So how do you go about building and assembling an expert team when you don't even know what the experts are, maybe, or how did you learn this whole thing and put it together?
Here's the secret. Any great entrepreneur would put a structure together. It doesn't matter if it's in their field and any other field, because we have the principles of how to lead, how to motivate, how to promote, and how to put something together that doesn't exist, right? So yes, I'm getting outside of my real estate development business to create a medical practice model that does not exist. It's one thing if I was coming in and setting up an executive primary care, which is out there, and I'm just taking something that exists and improving it. This doesn't exist. I guess understand now the core reason and the purpose. The mission and the vision behind this is so strong for me. It is the most important thing that I've ever worked on. I built many companies, and I currently have, I think, 65 entities. I can't keep up with it anymore, but this is the most important project. So I put my lifelong expertise in creating a business, managing a business, bringing the right people, and empowering people with the right mission and vision. I know how to do that extremely well, and that's the driver behind putting this together, and that's going to be the driver for me to make this work and spread it into 1,000 locations around the globe.
The team asked about, the team and that expertise. What about the logistics of it all? I mean, you described the facility before, very, large scale, obviously multiple floors, different departments in the context of an existing and developing business center, right? How do you even go, and this is probably where your real estate expertise, definitely helps, but Um, what are the logistics like to make a big project like this happen?
One of the biggest benefit I have is my position in this marketplace. I've been exposed to a lot of the leaderships in healthcare in general, doing real estate deals.
Hmm.
And because the fact that we only work on real estate, that doesn't mean that we don't get to learn about the practice. Because, I care about every building, every property I develop. I care about the end user. I care about to a point where how do patients come in? How do they go out? What enhancements and improvements we can make. And as my development model is, we don't just put up four walls. We basically create communities. We serve the community. We create spaces that are functional and that are needed and that changes lives of the people, from the patient walking through, from the doctors coming in, for the nurses, I think to the details of where do they go to have lunch. Let's create a space. Let's put a gazebo out there. If you have a location on a pond, I'll go and spend an extra $200,000, put a gazebo there because I care about that nurse. And I know if that nurse goes out during the lunch and has a comfortable environment where she can disconnect from her hustle and bustle day-to-day operations, then she will come back into the facility feeling better and more motivated. And now ultimately she'll deliver a better service, better care for the patients. That is in depth how I think about every detail about, these buildings. So having that level of understanding of the healthcare space and knowing the people, knowing the business, and frankly, most importantly, Antonio, is having to go through the 3 years of multiple healthcare systems and really discovering and unfortunately, seeing the lack of details, lack of attention to those humankind matters is
Yeah.
what drives me more than anything. And sometimes the simplest thing that is missing is so important. And you can't read about these things. And if somebody told me about this, I probably wouldn't be as passionate and as detail oriented. But
Yeah.
I was there. I was there with my son,
Yeah.
and I know that you can throw a two-person sofa, and then you can convert it into the bed, and you just stick it in the hospital because it looks good and the color matches. Damn it, it's beyond that. Put something comfortable. Your kid is getting major drugs and probably throwing up all night with feeling sick, miserably sick, and you there and you typically don't get any rest. And when you lay down for the 30 minutes, the system should give you a more comfortable sofa so you can rest. I mean, not many people are thinking about those details. I do. As a matter of
Absolutely.
fact, before TyMe was born, one of my goals was I said, I'm going to go around to every cancer hospital in the United States and I'm going to supply comfortable sofas for those parents because that's something I can do. And I know that would work and help people. But I ended up with a much greater vision and something substantially bigger than that. And by the way, I still do intend to do that when we get TyMe up and running and it becomes so profitable. And part of the proceeds will go into key simple details that could really make a difference. And frankly, we'll be doing those for a period of time till we cure cancer altogether, and where our kids are not suffering in these hospitals and parents are not suffering in the hospitals anymore.
Yeah, it's a beautiful vision.
Love it.
I want to take a step back and talk about the traits of great entrepreneurship and really the traits of being a great CEO and how important you feel it is, because you're talking about the every little detail, knowing everything about the experience, about, as Antonio asked, about just the infrastructure, how it all comes together, who these people are on your management and leadership team. How important is it for a CEO, for CEOs to be successful, to be at that level of detail?
That is, to me, from my perspective, that is the key. A lot of CEOs can do a good job. You only do a good job. Well, you will only deliver a good job if you basically follow the path and you're an ordinary CEO or any position this applies to. If you're not focused on the details, you're going to do a good job. But for you to do an extraordinary job and do something different and create something above and beyond, you have to have that level of attention to every detail. You got to think about human touch, where a material meets a human individual who is in need of the service. Those are the details makes a difference. For example, in our center, it's a very simple detail. Today, you walk into the nicest or the most sophisticated healthcare system in the world, and they happen to be here in the U.S., and I happen to be a patient in those organizations. You walk in, and they'll say, what's your name? The same as this, behind a window, and that's the first question. There are a bunch of people in the room. Say, what's your name? You state your name. They're usually not polite. And they say, date of birth. I'm okay with stating my date of birth, but if it's a female, you have 20 people standing in the room, it's kind of embarrassing. So paying attention to details. So in our system, when you pull up to our parking lot, Tim, it's a simple technology we have. It's out there. Everybody has it. We'll know that you pulled up to our parking lot. When you walk through the door, we know you're there. So instead of asking you for your date of birth, we're going to say, welcome to TyMe Institute. That is our difference. That's the level of sophistication and difference we're going to implement in this center that doesn't exist anywhere else.
David, there is a financial component to get this project going, right? Obviously, the vision, the mission are outstanding, but we worked through the numbers, and we quickly realized this requires a real estate investment, a development, research and development, a working capital. I mean, every angle that you look at it to make it feasible, it requires substantial investments and financing. So I wanted to ask you, what did the journey look like? And I know some of it's still in process, but anything you want to share about that piece of the equation?
As you guys know, last 3 years, capital markets has been very challenging since we basically decided to move forward with this TyMe concept. Interest rates shot up, cost of construction's gone up, everything's gone up. Inflation on one side, escalated interest rates. So everything you can think of was thrown at this project or any project, any new startup project. And banks got really shy of lending to any new startup. So this is a major startup and there is no track record, there is no history. So this became extremely complicated and challenging. And frankly, I could have taken a shorter cut and gone, put my hand out and gone to certain organizations, asked for money. This is our baby. I want to create this the way I want to create it. I don't want to have any influence from anybody, any organization to tell us you can't do this, you can't do that. So with that vision, we went out there and took the difficult path. So I worked on it the last couple of years. As you know, Antonio, it's taken us a couple of years to put together the funding. It's basically a self-funded project. I'm 100% responsible of financing of the project. It took us a couple of years to put it all together. We have now. Guess what? I make all the decisions and I control our destiny. I'm very happy about that. Was it easy? No, it was very complicated and challenging, but we're here again. I think it's the strong mission that we have. Mix it with faith and this interesting support and guidance we get. I think we have something very unique and special here, and a lot of very special people, interesting people has been touching this, like yourself and your team, to make it incredible. So it's basically a lot of different things coming together to make us happen. And as you know, Anthony, I have a very rapidly growing real estate development business, and typically anybody in my position would put their dollars in, and this is a substantial investment, and they would keep their dollars in the segment that they're comfortable, where they have the experience. I'm
Right.
taking so much risk with this, but this is what's in my heart, and we made it work. We're here, and October 18th is when we're going to open our center. In spite of all the challenges and difficulties, not one second I quit and gave up. No greatness come out of easy, guys. So it's been
Mm.
challenging, but if you think you can, you will, and we are.
Yeah. In 10 years, what single statement would you like to be true about what you've been able to accomplish?
In 10 years, I want to make sure that we preventing 50% of cancers. And I want to make sure that we have drugs that work for everyone's cancers, not just for a few people. The biggest challenge with cancer treatments, everyone's cancer is unique and individual. So all three of us could have bone cancer here, for God's sake. Your bone cancer is going to be different than mine. That's why when you give same drug to every cancer patient, some survive, some don't. It's just luck of draw. We want to take that luck of draw out of the equation. We are working on producing treatments that are unique to individuals. So in 10 years, I like to think that we will cure cancer.
Wow, big metrics and measure of success. I don't know if we could talk for hours, but maybe my last question, David, is you obviously have some very successful and prepared people on your team. that work at arguably the best organizations, healthcare organizations in America and in the world. They've got potentially a lot to lose by joining this startup high risk project. But they said yes. How easy or hard was it to convince them?
It wasn't challenging. Most of them know me, and when we sit down, when they hear the mission and vision, cause and reason, and logic behind this, and level of my commitment and motivation, hasn't been difficult, Antonio. We got an amazing team, and it's going to continue to grow. And the internal team that is here at TyMe and working on all fronts right now, all cylinders. Aside from that, we have some amazing partnership with some of the most reputable and largest organizations that are looking at us and they're listening to us and they're very intrigued by the model. So we haven't signed any dotted lines, but we're looking at some major partnerships that will take TyMe into a fast track. Ultimately, since the goal and the mission and vision is to get this model to as many people around the globe as quick as possible, I will remain true to that and create any partnership that drives us to that point. I want the cure to come sooner than later. I want to help as many people. So if a better decision making is the kind of idle for 5 years for a better financial outcome, that's not what I'm doing here. I do a lot of it in the real estate business where, I'm just another real estate developer. Here, this model here, we want to get it out to in front of people and we want to make a difference. We
Yes.
want to do it as quick as
And
possible.
David, I love that by doing this, by building TyMe, you're also pushing the rest of the industry to catch up, right, to those standards. And the moment patients try it and other providers realize what's out there, this new model, hopefully that will set the standard for the excellence that you're aiming for, and that will become that excellence available for everybody in the near future. So I love that more than anything about your project.
Thank you. Thank you, Antonio.
Thank you.
And I thank you and your team. You guys been a great partner. It's one thing to have a great vision, great idea. It's got to be financially feasible. Although our main driver is not the financial gain, but I want it to be extremely successful so that we can grow. I understand and acknowledge that um, unless you have the financial model working for you, then unfortunately the missions and visions and drive doesn't get you anywhere. So that's the part that I think I bring in that's really important for my team. You have amazing scientists and folks that's been doing this for 30 years and they would continue to do it in their corner for the next 20 years. But we all make such a great partner, and I'm the guy who's going to get them to produce these things and make sure that they don't end up on shelves. They end up with real people and for real results.
Yeah. And it's not hard to see why people would follow you into battle and over the hill and into the middle of the fire because of your passion, your charisma, your past success. With that being said, how do people get involved as we round this out? What are ways that people can get involved early? Whether it's from the financial side, from spreading the word, from having self-awareness, like what are ways that we can all support TyMe become what your vision for it is?
I appreciate that, Tim. Thank you. We have an event coming up May 2nd. That's my son's birthday.
Gotcha.
So we wanted the year after he passed away, we wanted to have a celebration of life for him. We just couldn't do it. We couldn't even look at the pictures, and it just my wife and I couldn't do it. We're at a point now with birth of TyMe, we're able to do it. So May 2nd, we're going to celebrate his life and we're going to launch TyMe to the world. And at that point, we'll have our website up and running, and we will have information, Tim and then Antonio, and you will get access to. And anybody that's interested, they can reach out to us, and we'll talk to them and figure out what synergies. Again, our goal is to get the word out, get this model going, and reach as many people as quick as possible. And we would welcome any connections, any synergetic structures that helps us get where we need to be.
Awesome. Well, thank you for the time. Thank you for your passion on this because it's something the world needs. We will put your contact information down below to make sure that anyone who out there is interested in this conversation could take it further and learn more. Thank you so much again for the time.
Yeah. Thank you for the opportunity, Tim. Thank you, Antonio.
Thank you, David.
All right.
This
Take
was
care,
fun.
guys.